When you hear a doctor say to you, oh, you're within the normal range, it's mostly meaningless because those normal ranges on lab tests are based on large population studies and includes or people who are already sick. And so they skew the results to have us think, okay, it's fine to be in the normal range, but it really means that your body is declining.
Welcome to Brainstorm by Us Against Alzheimer's, a patient-centered nonprofit organization. Your host, Meryl Comer, is a co-founder, 24-year caregiver, an Emmy Award-winning journalist, and the author of the New York Times bestseller, Slow Dancing with a Stranger.
This is Brainstorm, and I'm Meryl Comer. Today we're joined by Dr. Florence Comite, endocrinologist and longevity expert, whose work in precision medicine and healthy aging has pushed the conversation about dementia into far more urgent territory. In her new book, Invincible, Defy Your Genetic Destiny to Live Better Longer, she challenges the idea that cognitive decline is something we simply accept as we grow older. Instead, she argues that how we age and how we protect our brains is shaped by biology that looks different in women than in men. Dr. Comite, thank you for joining us.
Thank you for having me. I'm looking forward to the conversation.
You know, you describe aging as happening in different patterns rather than one uniform process. So what does your framework suggest about the difference between chronological age and biological age?
So let's start with chronological age. That's basically your birth date. And to the extent that every year we have a new candle on the cake, we get 1 year more mature. And it varies from person to person as far as what happens biologically, which means that the body has patterns of aging that can even vary within one human body. So for example, if you're doing things that are healthy for you and will offset rapid aging of organs, you might be aging 0.75, like 3/4 as fast as chronological aging. So for every year on Earth, your body may only be staying younger year to year. And so effectively, when you're 50, maybe you're really 40 internally. And that applies to organs too. So different organs in the body can age differently. You can have a really healthy brain, but maybe your heart isn't as healthy. And I see those patterns express themselves in people very differently, largely driven in part, I think, by genetics and genetic variants.
So which lifestyle or metabolic factors most often push people into an accelerated aging before they realize it?
So everyone is unique, and you don't necessarily see these patterns in the mirror. You could look fantastic on the outside and actually even test well in terms of the fact that something called a VO2 max, which is endurance on a treadmill, and what your heart's doing, your pulmonary system at 50 or 60 can look like a 25 or 30 year young person. But in effect, under the surface, at the cellular level, we're declining. And that decline can affect us in a variety of ways. Again, very unique to the individual, but begins to be seen at the cellular level in your 30s.
I've been all over your book, and the Comite Precision Health Questionnaire in the appendix pointed to me gaping holes in our system. A fact that only 1 in 5 Americans see a doctor on a yearly wellness visit, familial health history. That wasn't traditionally shared generationally. It was kept quiet unless something happened. And the other point that screams out to me is that normal range is not optimal. And we've turned it all over to our primary care physicians.
It is a challenge. And not only that, many of us don't have a primary care physician, whether it's an insurance driver or the fact that most physicians now don't go into solo practice the way Dr. Welby did in the past on TV. And I think that the fact that there are lifestyle options we choose that may undermine our health, as well as the genetic propensity to get disease, makes it very difficult to have an ongoing dialogue with someone who gets to know you, might know your family, might be able to focus on why things are going south, even without diagnostic tests of the sort we have today. But certainly the tests we have today and the way we can look into the body, almost with X-ray vision, looking at biomarkers, looking at MRIs, all the different ways we can test the body, the in-body, which can look at percent body fat and muscle, very critical element for longevity and health, are just not at our fingertips for most of us. Most of the information is coming through social media and is compromised because it's not really medicine isn't factored into it. It's medically challenged, I think.
I mean, how do you separate out promising longevity interventions from the hype? And what are the basics when it comes to slowing or reversing accelerated aging?
That's a great question. It's hard for the person on the street to not look at the hype because it's all over, right? And I would say, look for the credentials, look at the science, look to see, is this person an influencer? Even if it's a trained physician influencer, are they actually working with patients? Do they know the outcomes of what they're doing? Has there been research that's applied, real world research even, so that you can tell the difference between what might be legitimate and what might be just a fad and a trend? And then don't believe that everything out there is applicable. So, for example, even something like intermittent fasting, where I think a lot of people enjoy it, think it really helps them with their body and their health, it is not a good thing for all of us. So it's very specific to how we can look at ourselves. And I think that's where the game changes are for this century, in that with wearables such as the Apple Watch or the Whoop or the Oura Ring, and with the ability to even monitor ourselves in terms of our glucose, we can see those changes. We can see what's happening 24/7. Should we be so inclined? That may be better insight than what we are getting on social media.
For those that have dementia in their families, what matters most? The genetics, the biomarkers, the daily habits?
So we have many, many people who test positive for ApoE4, homozygote or heterozygote. Many of them have family members, and I've taken care of some of them for a decade or two. They have family members, every single family member as they age got Alzheimer's dementia. Now, there's a lot of other reasons for dementia, and I'm sure you're well aware that metabolic abnormalities, diabetes that isn't controlled, hypertension or high blood pressure, thyroid condition can all lead to difficulty maintaining function in terms of your brain, memory, and cognition. And so none of the patients I've cared for have even begun to see signs of any of these issues because of the way they can own their own decisions about the habits they have and understand what we can do, including the use of testosterone, which I feel is vital. Testosterone and estrogen are vital for brain function to the extent a person can tolerate it. You have to look at the indications. I would not give every woman estrogen because some women may not tolerate it because of other reasons, or if they're concerned because there's breast cancer in the family. But testosterone, I've used it very successfully in some men and women where memory was a huge issue and they had a high risk of Alzheimer's. And I was shocked to find out the change in memory was dramatic, particularly with testosterone. But there are studies that are showing that this is what's going on at the level of the brain.
You know, it's very disturbing that doctors say, "Oh, you're in the normal range. Come back and see me next year."
Yeah.
When they're waiting for symptoms instead of treating aging itself as a risk factor.
You're exactly right. I think of aging as a gift, to be fair. If we're lucky enough to live a long life to 100, 120, how wonderful, or even 90, right? When I hear people pass away in their 80s, in 70s, and I hear a patient say, oh, they were old already, they were 75. I'm like, 75 is not old. In this day and age, if you can own some of the factors that keep you in great shape, living till 100 is a real, absolute, we can do it. We can all, but there's so many people living to 100, they don't celebrate it on TV anymore. But it's knowing what are the factors that affect you specifically and what runs in the family, and then working with a medical system that is sick-centric, reactive, and waits for symptoms. So you're 1,000% right about that. Bringing the attention to yourself and sharing what runs in your family with your doctor and asking your doctor, what can I do today, whether you're 20, 30, 40, 50, to stop the advances of diseases of aging, which are what we're facing. Not aging itself. I'm really one of those who think I'm grateful to be living a long life and I want to live with as much vitality as possible. Tell your doctor if a family member has dementia. Tell your doctor if there's thyroid or osteoporosis. If you're lucky enough to have a doctor that you see on a regular basis, at least yearly, update them on what's gone on for the elders in the family, or even people who are younger who may have face a new disease that they're unaware of. And that's what runs in our genes. So being able to be aware of family history and putting that to work is also a very important component of what I espouse.
Let me ask you, how often is brain fog, which is not uncommon in women in menopause or perimenopause, an early signal of a deeper aging process that deserves medical attention?
So I think all of brain fog should be looked at, and I have that in quotes because it's not a clear-cut medical diagnosis, but it's a very commonly requested, I need help, my brain, I'm fuzzy, I don't remember things, I go into one room, I'm not sure why I'm there. Some of that is expected if you're under stress, if you're worried, if there's a lot going on. It can even happen at 20 or 30 or 40. I think if the factors are disturbing enough to interrupt what you're doing, even if they're minimal, meaning you weren't like this and why is this happening now, then it deserves to be looked at in a deeper way and to do the kinds of tests and measurements. We're getting a better handle on factors like, for example, tau 217 and amyloid ratios to be able to say, there is a decline here. There is a number here that isn't as promising. Let's look deeper. Some people will want that, but other people might be scared. So it's weighing those factors. I know I've had patients who weren't happy to hear that they had ApoE4. They were quite disturbed. And they honestly looked back and said, well, why did you do that? Why didn't I know? And even though we prep people to say, listen, this is the kind of information you're going to hear, is an adjustment to understanding their limitations. But I think the brain is exposed to a different combination of hormones and metabolites in men and women because we are not the same. And we could talk about the changes with aging. It's in the book in chapter 4 and 5, menopause in women. If you have a partner you care about, that's a male, andropause in men. But I think because we are seeing different combinations of estrogen, progesterone, and testosterone, as well as other hormones, we age differently. Our brain ages differently. And so that's an important component of, I think, why women tend to have more dementia than men. We don't have to get the disorders that our parents and grandparents have experienced by owning more insight and following and monitoring the kinds of things that change the direction of our health personally.
I loved your positioning that the real goal, it's not the goal to just delay aging, it's to delay the point when aging becomes disease.
Unlike most physicians, I was lucky enough to be trained across a variety of specialties, all in endocrinology, hormones, metabolism. It led me to other areas, but because I also did research and was trained in human research or clinical investigation at the National Institutes of Health, I had the benefit of looking at every decade of life and recognizing that we were beginning to go downhill, even if we didn't realize it in our 30s. And that's exactly what happened. And so I recognized that if we could look beneath the surface, if we could find out how a person lived life, what I think of as their health story, we could take those factors, marry it, and connect the dots to the biomarkers and the findings diagnostically, and then be able to redirect your future health trajectory. That is, stop the decline, which I think of as disorders of aging, diabetes, heart disease, dementia. All of that is related to the fact that as we're getting older, our body doesn't perform in the same way. And my question was, how do we stop ourselves biologically from getting older? How do we keep the same health that we were able to enjoy, most of us, in our 20s?
So walk us through the 7 types of aging. You didn't have one broad category. There are 7 types. So are these patterns more common than people realize? And what challenges most conventional medicine?
Because medicine is so complex, we wanted to figure out a way to share the areas that are of most concern to most of us. And by dividing it up into patterns, and it's more than one pattern per person, because each of us, men and women, are going to undergo hormonal and metabolic aging. But men and women do age differently. For men, it's more linear. For us women, as the ovaries begin to decline and are unable to produce eggs, we hit menopause a year after our last menstrual cycle. So these patterns of aging are far more common than people realize. And it's a challenge to conventional medicine because they don't look at aging proactively. They wait for symptoms. They wait for the emergency room the department to make a diagnosis of diabetes. In fact, in 80% of the people who have that diagnosis, is generally made in an emergency room. Whereas in precision medicine, we're looking for the data ahead of time. So the 7 areas of patterns that we all need to look at and to see what runs in our family, what may be affecting us already, depending on where we pick up this book and how we interpret it, right? The first and probably the most ubiquitous is a carbohydrate metabolism disorder. That means that we have a problem internally. The problem is dictated by genes and the life we live, of the combination of what glucose does to almost every cell in the body. So diabetes, which we're all familiar with, and we think of that in terms of a sugar disorder, actually affects every other cell in the body. It leads to heart disease, stroke, eye disease, or kidney disease. So that's one big topic. Heart disease is the second one because it probably kills more people than every other disorder, like including all the cancers combined. The other bookend would be sarcopenia, or loss of muscle. And that is tied also to sugar because it's muscle loss as we enter our 30s and 40s. That means we don't have a way to shelter sugar and we become weaker. And it leads to also the fact that many of us, at least 25% of us as we age, will have bone loss or osteopenia and osteoporosis. So that's a pattern that we talk about. And finally, maybe most important from your lens, is the dementia, brain fog, and metabolic disorders of aging that can affect the brain, including, of course, Alzheimer's.
So you've mentioned the types that are most underdiagnosed. What harm does that do to the patient, and how do you break it out in terms of age? How do you recover?
Most of the time, the only test that's done is a baseline sugar test. We're not looking for insulin resistance, pre-diabetes. We're not looking for the signs and symptoms that we can see decades before. And mostly the other side of that issue is the fact that when you hear a doctor say to you, oh, you're within the normal range, it's mostly meaningless because those normal ranges on lab tests are based on large population studies and includes people who are already sick and who are leaning down into declining health. And so they skew the results to have us think, okay, it's fine to be in the normal range, but it really means that your body is declining. It's not optimal. And that's what we need to think about. How do we make things optimal?
That was so upsetting to me. The doctor says you're in the normal range and you feel great. And that's not the case, right?
It isn't. I'll give you a very specific example because so many people know about GLP-1s, Ozempic, and tirzepatide. And the reason, if you see the dancing commercials, they'll say, get your hemoglobin A1C down to 7. Now, hemoglobin A1C is an average of 100 days of your sugar. Averages mean very little. I, for example, had a beautiful average. It was less than 5. That's what you want. 5.7 to 6.4 is pre-diabetes, and 6.5 and up is diabetes. So getting your numbers down, your hemoglobin A1C to below 7, means you could still be a diabetic or a pre-diabetic. It's putting you in the optimal range that's key. And that means a sugar that measures 70 to 80 when you're fasting, insulin that is undetectable when we're fasting, and a hemoglobin A1C that's less than 5. And the combination of interpreting how all those three count is really very valuable. And that's not something that's routinely done.
Unfortunately, I think most people end up assuming that aging is only about appearance or energy. So they miss the bigger points that you're making.
I agree with you. And energy is a huge factor in aging. In fact, one would believe that with all the prescriptions for testosterone, which is critical to maintain muscle, by the way, in women, just like in men, we have more testosterone circulating than estrogen in general. And we continue to make testosterone, but we start slowing down in our 30s, just like men. And that's critical for muscle, right? We are in trouble when we can't sustain our body strength. And in fact, we get into more trouble. It's not just fat. We need more muscle, but we don't want to lose all the fat on our body too, because that's protective. Those signs of aging at the cellular level is really very critical.
So we don't want people looking at all these types and becoming overwhelmed because they see themselves pigeonholed in one or two. Which of the 7 types are most likely to be reversible with early intervention?
Well, here's my bias. Every single one of them.
Okay.
I have diagnosed diabetes or prediabetes or somebody heading to diabetes in just about everybody I see, even young folks who are like 25 or 30, because we genetically have a predilection to put fat in our body and to hold on to sugar. So the simple ways that people can start by understanding underneath and taking baby steps, which I strongly advocate, is to focus on baby steps, one thing they can do at a time. And if they're open to it, wearables can really give us insight into how our body is performing, independent of going to a physician. Wearing a continuous glucose monitor and looking at what sugar does. In fact, I specifically, I'm thinking of one patient who I just said hello to earlier today, who is in amazing shape, absolutely amazing. He performs at the level of a 30-year-old when tested in terms of exercise. His percent body fat is less than 10, but his sugar is all over the place and he doesn't get great sleep. He gets almost no deep sleep, and he's in the earliest stages of Alzheimer's that we're reversing. I've been taking care of him about a year or two now, and we're doing everything we can. And it's only by monitoring his own sugar 24/7 using a continuous glucose monitor that we were able to show him what sleep was doing to him and what his own genetic makeup was. Now, Alzheimer's runs in his family. There was no question about it. But our goal is to not let him slide further, to reverse what he's actually seeing in the way he's living.
So let me ask you, why do you think that brain aging is still so often treated separately from the rest of the body's aging process?
I think that question applies to everything in medicine. And the simplest answer, in conventional medicine, we're all slotted into silos. So a cardiologist is going to look at the heart. You tend to get more obvious symptoms from heart disease than from brain disease, I think. And they're not trained to look at that. Neurologists look at the brain, but you're referred to a neurologist when you have symptoms already. We're starting way too late to look at the body as a whole, as a system, as opposed to breaking it down into parts and then going to different specialists that can examine those parts. So we need to start much earlier in life proactively to look and determine what is your makeup, how you're living life, to be able to turn that around. So I advocate starting slow, starting with the 5 biomarkers I mentioned in the book, which is fasting sugar, hemoglobin A1C, and fasting insulin, along with a cholesterol measurement of cholesterol risk ratio, which is the total cholesterol divided by the good cholesterol or HDL, and a free testosterone. And those 5 biomarkers should be in everyone's hands to see what path they're on, what their future health trajectory looks like, so they're not overwhelmed.
Our guest has been Dr. Florence Comite. Her new book, Invincible, Defy Your Genetic Destiny to Live Better Longer. Her research reminds us that when it comes to dementia, the best time to act is long before first symptoms. And that timeline belongs squarely in midlife. Because at Us Against Alzheimer's, our call to action is know your risk, track your brain health, and take action early. That's it for this edition. I'm Meryl Comer. Thank you for brainstorming with us.
Subscribe to Brainstorm through your favorite podcast platform and join us for new episodes on the first and third Tuesday of every month.